Hello everyone, I am Pandyax. Welcome to the live section of Facebook. Today we have Dr. Vijay Krishna Jasthi, one of the famous radiation oncologists in Guntur. He have over 6 years of experience in the field of radiation oncology. He completed his MBBS from NRA Medical College, Guntur, and he's done his post-graduation MD in radiation oncology from GSL Medical College, Rajahmundry. He done fellowship in advanced techniques from Tata Memorial Hospital, Mumbai. He also has a senior residency experience for 1 year in Government General Hospital, Guntur. Here we have Dr. Vijay Krishna sir to discuss about head and neck cancer. We welcome you, sir, on behalf of OMOI Guntur.
Thank you.
Sir, first and foremost, why did you choose this topic?
The main reason for choosing this topic regarding head and neck cancers is that the incidence trend is on the rise, and the particular awareness regarding this head and neck cancers is low in the general society. So we intend to bring more awareness through discussions like this Facebook Live and all those. And so today we are going to discuss regarding all the aspects related to the same malignancy.
So, what is by head and neck cancer?
Head and neck cancers constitute a different number of structures and the cancers related to it. So all the structures in the face and neck, excluding brain, that is the nasal cavity, sinonasal lesions, the area behind the nose which is called the nasopharynx, the oral cavity tumors which constitute those of the lips, tongue, buccal mucosa, hard palate and all those, and the area behind the oral cavity, that is the oropharynx. And below the oropharynx is the hypopharynx, the region here. And anterior to it, we have the larynx, which is the voice box, and the thyroid. All the cancers related to any of these structures come under head and neck malignancies.
Which are the common features in daily life, and what are the risk factors?
Risk factors related to head and neck cancers, the most important and predominant risk factor is smoking. The patients or the people who have the habit of smoking are highly prone to get head and neck cancers, particularly the oral cancers and the oropharyngeal cancers. Apart from smoking, there are areas like the tribal areas in the Godavari district and in the North Andhra where people have the habit of reverse smoking. And that has even more higher incidence of causing cancer. Apart from it, the other factors like alcohol, chewing tobacco, gutkha, kaini, and injury to the oral cavity, particularly to the tongue or buccal mucosa, or sharp tooth or dentures, all these contribute to malignancies.
So,
And coming to the different manifestations, based on the site, the manifestation, that is the signs and symptoms vary. Like for nasal cavity or sinonasal lesions and nasopharynx, the main complaint will be like difficulty in breathing. For pharyngeal lesions like the oropharynx and hypopharynx, which constitute the throat part, the main complaint is the dysphagia, that is difficulty in taking food. And later, if the patient doesn't come to the hospital in time, the difficulty in taking food slowly progresses to difficulty in taking even liquids. And later, the regurgitation, that is whatever food they take in, it comes out. And apart from it, for the oral cavity lesions, that is those lesions in the mouth, usually you'll be seeing a visible lump or a swelling or sometimes ulcer, and patient will be complaining of pain or burning sensation. Apart from that, any swelling in the neck, like those behind the ear in this area, that's called the parotid region. So parotid swellings are an indication of a parotid malignancies, or swelling in the thyroid region, that is here, that is an indication for probable thyroid cancers. And sometimes you will be noticing swellings in the neck on the lateral side, on these sides. Those are mostly the lymph nodes. So any of these features, along with complaint like prolonged ear pain. Prolonged ear pain can be one of the most common feature for malignancies, because most of these areas are supplied by the same nerve, which even goes to the ear. So prolonged ear pain is one of the main symptoms.
So, how do you approach for diagnosis and stage?
For the diagnostic part, the main test is a biopsy, and sometimes we even proceed with FNAC for the lymph nodes. And biopsy is helpful in establishing the type of the tumor. And next, we'll be even doing the imaging workup like the CT, PET CT, or MRI. MRI is more useful in diagnosing CA tongue and for nasopharynx and these structures which are the soft tissue lesions, and CT for the rest of them. And PET-CT is more helpful for ruling out any distal medicine like the lung mets, or sometimes if the patient is a smoker, you can have 2 or 3 different primaries, that is 2 or 3 different malignancies at the same time, which we call dual malignancy. And all these can be detected through PET-CT. So based on biopsy, which helps in establishing the type of the tumor, and imaging tool like the CT, MRI or PET-CT, we establish the stage of the disease.
What are the available treatment options for head and neck?
So the 3 available options are surgery, radiation and chemotherapy. Actually, the role of chemotherapy in head and neck cancers is a bit limited. The mainstay of treatment for most of the lesions in head and neck is the surgery. So early lesions are mostly surgically operated and removed. But most of the head and neck lesions are not operable due to different causes like the inaccessibility and mostly due to the late presentation. So most of the time we'll be treating them with radiation therapy for about 6 to 7 weeks.
So is there any difference between the older treatment and the latest?
So the older treatments, earlier patients were treated using cobalt machine. In that treatment modality, the chance of sparing the different other organs, like if you are treating for head and neck malignancies, the main structures which are at risk are the parietes on the other side and the spinal cord. So usually in the earlier days, if the patients were treated, there was high chance of dryness of mouth after treating with RT, and some used to have cord damage. So the present techniques are through LINAC. Particularly, we have the machine which is called the Halcyon. Now on this Halcyon machine, we can actually spare very well the parietes, the spinal cord and the other structures. So with this, the side effects are very much minimized, and we can give dose intensification for the targeted structures.
What are the treatment outcomes?
Treatment outcomes are mainly based on the presentation. The earlier the presentation, definitely the treatment outcomes are very good. Particularly in head and neck cancers, there is a lot of difference between early presentation versus late presentation. Early presentation of head and neck malignancies can be operated except for the pharyngeal lesions, and when and where the patient is amenable for surgery, even if there is an indication for RT, it's much better. For most of the cases, there will be an indication of adjoint RT. And these patients, usually the chance of relapse will be very low, and they'll have good disease-free survival. But those patients who present with an advanced disease, having neck nodes or locally advanced disease, usually they carry dismal prognosis. And we actually, the main reason for selecting the topic today is to bring awareness regarding the same aspect, so that people come to hospital at an earlier time, so at an earlier stage.
So what is your advice for awareness of head and neck cancer?
Whenever a patient has any suspicion with regard to any swelling or ulcer or prolonged complaints like ear pain, difficulty in taking food or change in voice or any of these features, it's always advisable to come either to a cancer center or to a ENT physician and get a proper checkup done.
Thank you viewers for watching our video. If you have any queries, please comment us in our chat box. For more information regarding the cancer treatment, please subscribe to our channel. Thank you.